So I have my supplies that I will be needing for this video. Hello, my name is Bree. I'm going to be your student nurse today. Do you mind telling me your name and date of birth? And do you have any allergies or any contradictions that I may need to be aware of? Alrighty, and are you currently in any pain? No? Okay, so today I'm just going to be doing a cardiac and respiratory assessment. This is just going to kind of give me information that I may need to know for your plan of care. So today I'm just going to first start by asking you a few questions. Have you recently experienced any chest pain or shortness of breath? No? Okay. And have you felt any abnormally sense of tiredness at all? Do you have any cardiac disease or history of it? Do you have any history of cardiac disease in your family? Okay, so my patient is answering all of my questions appropriately, which tells me that they are alert and conscious, which allows me to continue this assessment. I also wanted to ask, do you have a cough at all? And do you use any oxygen ever? Okay, so at this point of my assessment, I would also collect my patient's vitals. For the point of this video, I will not be doing that, but I would know if they are within normal limits or not. So I'm now going to continue for this part of the assessment. I'll make sure that the head of the bed is 30 to 45 degrees, which it is. And I'm just going to first start by looking at your neck, and I do not notice any bounding or bulging pulsations of the jugular veins or the carotid arteries. So I'm then going to take my pen light, and I'm just going to have you look that way. I'm just going to assess the jugular veins with my pen light. I'm going to have you look this way. All right, well, looking at that, I noticed no jugular vein distension, which is expected, so I'm now going to palpate each carotid artery individually. Alrighty, and I would note that this is a +2 in strength, which is expected, and it was equal in rate and rhythm, so this tells me that I can now move on to the chest. I'm now going to move on to your chest. Is it okay if I pull your chest down so I'm able to hear everything accurately and see everything? Okay, thank you. All right. So, when first looking at this, I can see that as they are breathing, it looks as though everything is symmetrical and it is rising well. I also see that there is no barrel chest, which would tell me that, which would indicate if they had COPD or not. There's no use of accessory muscles. Size and shape, it's wider than it is deep, and the ribs are angled downward, which is all expected. So I'm now just going to put my hands here and have them inhale. Can you inhale for me? And I would note that their lungs are expanding equally, which is expected. So I'm now just going to look in the area of the apical pulse, noting that there is that I can see no visual pulsations, which is expected. So I would now palpate this area. When palpating this area, I would note that I felt a gentle pulsation, which is expected. If I weren't to feel a pulsation, this is also expected. What would be unexpected is if I felt bulging of the pulsations. So I'm now going to move on to the cardiac assessment. For this, I'm just going to use my stethoscope, so I'm going to clean my stethoscope off. I'm not going to put this all the way in my ears. For a normal assessment, I would. This is so I don't hear myself talking. So I'm first going to start at the second intercostal space at the right sternal border, and this I will be listening to the aortic valve. From here, I would move over to the left intercostal space, or the intercostal space, second intercostal space, left sternal border, and I will be listening to the pulmonic area. From here, I'll move down to the third intercostal space, listening to the second the second pulmonic area, which is Erb's point. From here, I'll move to the fourth intercostal space, and if I had to move the breast out of the way, I would, still at the left sternal border. And here I'm listening to the tricuspid area. After this, I'll move down to the fifth intercostal space, move over to the midclavicular line. Here, I'll be listening to the mitral valve, which is also known as the apical pulse, and I'll be listening to this for a full minute. After listening to this for a full minute, I would note that I heard both S1 and S2, S1 being a low pitch and S2 being a high pitch. I would note that it was around 70 beats per minute, which is an expected finding. Everything was equal in everything was equal in rate and rhythm. And I would note that if I heard an S3 or S4, this would be unexpected and it would cause for further evaluation. So I'm now going to continue my assessment by listening to breath sounds. So I would start at the mid-clavicular line around the second intercostal space. And each spot that I put my stethoscope, I'm going to listen for a full breath in and out. So I'm going to move over now to the left upper lobe, still at the mid-clavicular line around the second intercostal space. From here, I'm going to move over to the right middle lobe, which is around the fourth intercostal space, close to the mid-clavicular line. From here, I'm going to listen to the left lower lobe, which is in the midline of the axillary. From here, I'm going to listen to the right lower lobe, which is also in the midline of the axillary. All right, after listening to this, I would note that both right and left sounds were equal in depth, and both right and side were clear. I heard no wheezing, crackling, rhonchi. There was no labored breathing or anything of that nature. So this was all an expected finding, and I'm now going to move on to my patient's backside. I'm just going to cover you back up. Just going to have my patient sit on the side of the bed. For the purpose of this, my patient usually wouldn't have trouble sitting, but it's a mannequin, so it's a little harder. So I'm now going to get behind the patient, and I am first going to notice the posture. I can tell that I would note that my patient is sitting in a relaxed and comfortable position. They are in a tripod position, which tells me they aren't having trouble breathing. I'm then going to notice size and shape. Again, they are angled, the ribs are angled downward, which is expected, wider than it is deep, and there is no, the curvature of the spine is straight. So I would now look for symmetry. All aspects of my patient's back is symmetrical as they are inhaling, but I'm now going to feel for it with a W and have them inhale. Alrighty. As they inhaled, I could tell that it was symmetrically, the lungs expanded symmetrically, and also as I'm looking for symmetry before feeling, I am going to have them be taking slow, deep breaths to really tell if it's truly symmetrical and the shape is all the way it is expected to be. So I would then listen to their back lung sounds. I'm going to start at the left upper lobe, about 3 inches away from the spine around the C7. I'm going to have them take a full deep breath in, or just a regular breath in and out before I move my stethoscope. I'm going to do this again on the right side, again around 3 inches away from the spine. I'm then going to move in a ladder position, so I'm going to go down to the right lower lobe in the auxiliary, in the mid-auxiliary line. From here, I'm going to listen to the left lower lobe again in the middle auxiliary line. Alrighty, while listening to all of these, I could hear that both my patient's right and left side of the lungs were all clear. I didn't hear any labored breathing, no wheezing, crackling, or rhonchi. So this is all an expected finding, and I would have them lay back down. Alrighty, I'm going to keep my patient uncovered, and I'm just now going to assess extremities. First looking, I can tell that all 4 of my patient's extremities are the correct size and shape for my patient's body size. So I'm then looking, just can see that the color of my patient's skin is pale, which is accurate for their ethnicity. And so I'm now just going to feel temperature. Alrighty, so their temperature is warm, which is expected for the temperature of this room. I'm now going to feel for edema. Alrighty, so there was no edema. Everything returned back to normal. There was no pitting or anything like that, so that is also expected. I'm now going to check my patient's skin turgor, which I could do on the clavicle or the back of my patient's hand. I'm going to do the clavicle, so I would just pinch right here. Alright, so their skin returned rapidly, which is an expected finding. And I'm now looking overall at the shin and the toes more seriously, that there are no ulcers or lacerations here, or abrasions. So this is also expected. I'm going to look at my patient's nail beds, and I can see that they are pink, which is an expected finding. There is no clubbing of the fingernails, which would indicate chronic inadequate perfusion to the extremities. So this is an expected finding. And I'm now going to do capillary refill. Alrighty, so on both hands, it returned less than 2 seconds, which is an expected finding, so I'm now going to do the toes. Both of these were also within 2 seconds, which is an expected finding. So I'm now going to move on to peripheral pulses. First, going to do both radial pulses. And I would note that both of these are +2, equal in strength and rhythm, and they weren't bounding or anything of that nature. So I'm now going to do the tibial pulse, which is by the Achilles tendon in this groove right here. Alrighty, so I would note that these are also both +2, equal in strength and rhythm on both sides, and I didn't feel any bounding. So this was also expected. Now do the dorsalis pedis, which is between the first and second toe, just right down here. Alrighty, so for both of these, they were both also +2, equal in strength and rhythm. I also didn't feel any bounding. So I'm now just going to cover my patient up. I'm finished with my assessment. Do you have any questions at all? No. Okay, so I have your call light right here. If you were a fall risk, I would make sure that your bed alarm is on. Looking around the room, I don't see any clutter that would indicate a fall risk. And thank you for letting me participate in your care. I'm going to go document your findings.